the top of government, being led by Kate Bingham, who is doing the job brilliantly as chair of the Vaccines Task Force. The best answer I can give my honourable friend is that no news is good news, because we're trying to prove a negative, which is prove that if you've had the virus, then you don't. If you have the vaccine, then you don't get the virus. And so the longer that we go on with the current, without hearing that there's a problem, the better. We're working to a reasonable best case scenario of getting the vaccine in some point this year, but I would stress that that is the best case scenario. The central scenario is somewhat later, and there is a chance that no vaccine will ever work. So we need to work for the best and give our vaccine programs the best possible support, but we should also be cautious about whether one will ever come off.
Video link. Tulip Siddiq.
Thank you. A former director of public health who lives in my constituency has been in touch with me to express serious concerns about the real possibility of a second wave of coronavirus and his fear that lessons have not been learned from the government's response to the pandemic. What plan does the Secretary of State have to get an independent body to conduct an accelerated review of the government's response to COVID-19 so far, so that we don't make the same mistakes again?
Looking, Mr. Deputy Speaker, at all of the evidence, and we take very seriously all of the academic, professional, and medical studies into the pandemic, the response to the pandemic, both here and around the world.
Dr. James Davis.
Thank you, Mr. Deputy Speaker. Further to today's announcement regarding the mandatory wearing of face masks in shops, is it anticipated that similar may yet need to apply in pubs and bars?
Well, we don't anticipate that at this point. We, of course, keep all things under review, but in the first instance, the proposal, in the same way that we brought this in on public transport and in the NHS last month, is to bring this in shops.
Chris Bryant.
If I can be cheeky, Mr. Deputy Speaker, I think I can help the member for New Forest West with his problem about wearing a mask. He's a knight of the realm, so he should just consider it a visor. But to the serious question that I want to ask, it's very clear from the way that COVID has rolled out nowadays that lots of people are going to have brain injury-like conditions. There's going to be a substantial need for long-term rehabilitation. And this mirrors the work that needs to be done for those who've had traumatic brain injuries and stroke. So can I urge, many of whom have not had the support this year for obvious reasons, but are desperate for it. I understand the Chancellor of the Duchy of Lancaster is setting up a cross-departmental ministerial group which will meet before the end of this month. Will the Secretary of State make sure that that rehab for people with brain injury, whether from COVID or from anything else, is in place?
Well, we're working on exactly that. And this is part of a number of questions that rightly have been asked about the long-term impact of COVID and making sure we have the NHS treatment available for it.
Thank you, Mr. Deputy Speaker. Asymptomatic workers in care homes are now tested every week. Asymptomatic workers in hospitals are not. Why not?
The programme that we have in hospitals is a risk-based one according to the risk of the individual. It is much harder to put that risk base in place in care homes, and both of these proposals, whilst seemingly different, are based on the same clinical advice.
I'd like to thank the Secretary of State for the statement today. Point of order, Munira Wilson.
Order, Mr. Deputy Speaker. As we're heading into another recess with the ongoing pandemic and a potential second wave, as we've heard today, on the way, does Mr. Deputy Speaker have any suggestions or provisions for how honourable members can scrutinise effectively during that period what the department is doing, given the challenges we have, as the Secretary of State has already alluded to, in terms of responding in a timely fashion to correspondence?
I'm grateful to the honourable member for her point of order and for giving me notice of it. Whilst it's not for the Speaker or me to advise individual honourable members or select committees how they may wish to carry out their work during recess, we may be able to help by emphasising again what the Speaker has said about the importance of correspondence from honourable members receiving prompt replies. And I agree that this will be of particular importance during a recess where the country is still facing a major public health challenge. I hope that ministers will give careful consideration to how they can support all honourable members carrying out their duties during this recess by providing prompt and helpful replies to correspondence. Mr Bill Wiggin.
Mr Deputy Speaker, thank you for that answer. You will be aware that 72